Put your hands. All right. Okay. Get on the ground now. Get on the ground. Get on the ground. Right side. Well, start it. Okay. Here, dude. Here, just come. All right. Please. Come on. Please stop, dude. Please. Start it. Roll your stomach. Roll your stomach.
Why is abuse on homeless a hot topic? There are more and more cases of these attacks. One of the most well-known violent acts against homeless is of Kelly Thomas. The short clip in the beginning of this presentation was of Thomas being abused by two Fullerton officers, even though he showed no signs of resistance. The left picture of him is before the attack, and the right is after the attack. He died 5 days later.
So what is violence? According to the World Health Organization, violence is the intentional use of physical force or power, threatened or actual, against oneself, another person, or against a group or community that either results in or has a high likelihood of resulting injury, death, psychological harm, maldevelopment, or deprivation. But there are many definitions of violence.
Violence against homeless is not just from police officers, but also from civilians. In 2002, the National Coalition of the Homeless reported of the 70 non-lethal attacks against homeless, 27 were beatings and 27 were with deadly weapons. Other attacks included fire, police brutality, rape, and harassment. Our target population is the homeless population in Orange County. As of 2013, there are 12,707 homeless in Orange County. The quality of life we are dealing with is high rates of violence and abuse against the homeless population. Epidemiology. California has the highest number of homeless in the U.S. with 136,826 in 2013. Next would be New York at 77,000. That's about a 60,000 difference. Violence against homeless is hard to accurately count because many go unreported. This chart from the National Coalition for Homeless shows that homeless crimes kill 3 times as much as other hate crimes, such as racial discrimination, sexual orientation, and religious-based crimes. Risk factors. Some risk factors for being homeless include lack of affordable housing, having mental illness, substance abuse, addiction, domestic violence and disability, and lack of support.
Historically, 2 trends are largely responsible for the rise in homelessness over the past 20 to 25 years: a growing shortage of affordable rental housing and a simultaneous increase in poverty. Starting with the recession, many factors which led to homelessness include foreclosures, loss of jobs, increased unemployment, high cost of living, increased poverty rates, and lack of affordable health care. Each culture has their own way of life and cultural beliefs which contribute to how they act out violently. Being homeless, the many intermingled cultural groups learn to adapt to their surroundings and the violence they are exposed to. Thus, a homeless subculture is formed, and then they typically become vulnerable to the same types of violence. In 2011, 63.7% of the homeless population were men, and of these men, 88% fell victim to violent attacks. The U.S. Department of Health and Human Services recognizes homelessness as an individual without permanent housing or in any other unstable or non-permanent situation. This chart demonstrates the ethnicities of Orange County affected most often by homelessness. Each ethnicity is exposed to violence based on the risk factor of being unsheltered.
Physical environment. Conducting a windshield survey, we found that Santa Ana and Anaheim had the highest concentration of homeless individuals. In Santa Ana, they would be in places like downtown Civic Center, and in Anaheim, parks and streets, and even in motels. However, they can be found in many different areas. As shown in the chart, there are about 12,707 homeless people, and it also shows how the homeless population is vulnerable to their physical environment, as many of them are left unsheltered. Homeless population usually travel with all of their possessions, and they would either be alone or congregate together. Education includes 25% dropped out of high school, 21% have a high school diploma, 32% have post-secondary education, 22% did not have a grade school education, but one's education level varies. For a majority of the population, they are educated on violence prevention in schools, but if they're not in school, then what ends up happening is that they learn as they go or as they become exposed to violence. A sort of internal survival instinct emerges. The streets not only teach you life skills, but also survival skills.
Our windshield survey reveals that the homeless population uses various means of transportation. Depending on their accessibility and financial status, the homeless of Orange County typically utilize cars, buses, bicycles, or walking. Crime rates against the homeless, such as hate crimes, rapes, and homicides, are often difficult to obtain from county records since many violence-related incidents against the homeless go unreported. Luckily, the Violence Against the Homeless Accountability Act of 2013 mandates the already existing Hate Crime Statistics Act of 1990 to now include the homeless in the Attorney General's annual data report of crimes that manifest evidence of prejudice. The CDC also works to monitor injuries caused by violence and helps states and local communities plan, start, and evaluate prevention programs.
Case managers like the Comprehensive Health Assessment Team Homeless, also known as CHAT-H, are a well-known group of public health nurses who serve the homeless population in Orange County. They help the homeless sign up for Medi-Cal and collaborate with local health providers and agencies to provide care like dental and vision regardless of insurance. Illumination Foundation is an organization that provides free services for the homeless such as mobile health care and job searching. One of the most incredible services offered is recuperative care. There have been incidences of hospitals dropping off homeless patients at parks because they have nowhere else to go. Being discharged without available resources to return to a healthy state often results in a vicious cycle that brings the homeless back to the hospital. So, IF created a program for hospitals to pay about $136 a night for up to 14 days so patients will recover with professional medical care, food, and other resources such as finding a job and permanent housing. Photos and videos of public violence can now be quickly posted throughout social media via YouTube, Facebook, Instagram, or Twitter. In other cases, violence about news is spread through the media. The news about Kelly Thomas was distributed by television and the internet. The average living cost in Orange County for one adult is $1,183. A living wage is a wage that is considered enough to cover for all food, child care, medical, housing, transportation, other expenses, and taxes. In Orange County, a living wage is $13.12 an hour for one adult based on working full-time. One adult and one child would be $24.81 an hour. Minimum wage in Orange County is currently $8 an hour. A person earning minimum wage would need to work 141 hours per week to afford a one-bedroom apartment. According to livingwage.mit.edu, a website dedicated to research statistics in American poverty, more than half of the occupations in all fields fall under poverty line for one adult and one child if they were to live alone. Unemployment rate in Orange County as of February 2014 is 5.8%. Most homeless people have little to no income because of the high living costs in Orange County. It is easy to correlate why there's a large population of homeless here. Based on some interviews of people who are homeless at Mary's Kitchen in Orange, their leisure activities include hanging out at parks, playing basketball, and visiting public facilities such as the library. Homeless population is diverse with all ethnicities. Most are aware of national holidays. Most homeless shelters, soup kitchens, and social services help raise the spirits of holidays by serving festive foods, decorating facilities, and incorporating the traditional customs that often come with holidays.
Diagnosis: homeless people in Orange County, California are at increased risk for violence and abuse related to not having shelter, having high rates of mental illness, and the negative stereotypes that the public has against them, as evidenced by 39% of Orange County homeless being unsheltered in 2013, 480 homeless people reported with a mental illness in 2013, and more than 100 violent acts against the homeless reported in California occurring between 1999 to 2011. Study 1. Comparing outcomes of major models of police responses to mental health emergencies. A high percentage of homeless people suffer from mental disorders. Given this, several studies have concluded that mentally ill, specifically the homeless, are more prone to suffering from police brutality and abuse. In an effort to do this, 3 different models of police training were compared to find the most effective one that produces the best outcome for the victims. In Alabama, the Birmingham Police Department works with community service officers that are available Monday through Friday and are specifically trained to de-escalate situations with mentally ill in a healthy manner. In Knoxville, the Mobile Crisis Unit services a 5-county area and responds to calls from the public in the jails that have persons who are mentally ill. In Memphis, the Crisis Intervention Team is composed to 130 patrol officers that provide a specialized response to mental disturbed calls. In order to be part of the crisis intervention, police officers receive 40 hours of specialized training from mental health providers, family advocates, and mentally health consumer groups available 24 hours a day. At each site, records were examined for approximately 100 police dispatch calls for emotionally disturbed persons to examine the extent to which the specifically trained professionals responded. Classifications for response were made based on how many arrests were made, how many criminal charges were filed, treatments, and on-scene resolutions. Interventions according to Minnesota Will. Advocacy. The study hopes to reduce brutality among the mentally ill and homeless by implementing the most effective police regimen. Policy development and enforcement. The study recommends regulations for other police departments to follow. Level of prevention. Primary. This study attempts to stop police brutality and unfair treatment towards the mentally ill from occurring. Level of practice. Systems. Attempts to find which programs and policies are more efficient within the police department to respond to mentally ill situations. Community. Advocating for at-risk community by attempting to reduce violence aimed at them. Results.
The results indicate that all 3 programs diverted mentally ill people from jail. However, the Memphis program had the lowest arrest rates of people in crisis, and the officers were on the scene more often and much more quickly. The Memphis program more frequently transported rather than referred people to treatment than did the other programs, and the Memphis program made the greatest positive impression on officers. Evaluation effectiveness. The study compared the different programs in several areas of responses based on their training and provided that one was more effective than the other. The Memphis plan stood out and had the most positive effects. Since then, cities including Albuquerque, Portland, Seattle, and Waterloo have adopted the Memphis plan. This study also promoted future studies that demonstrate reduction in the use of deadly force and injuries by officers and civilians and the use of restraint. Positives. The study compared different areas which allowed for similar populations to be addressed. It also compared different areas of responses to compare the effectiveness of each. Weaknesses and improvements. The study did not address the type of mental illness of a person involved. It did not include specific demographics like age, sex, and race, and it did not have a control group. Recommendations. The Memphis program appears to hold strong promise for communities planning to develop partnership between the criminal justice and mental health systems in managing crisis calls in an effective, expedient, and sensitive manner. Data strongly suggests that collaboration between the criminal justice system, the mental health system, and the advocacy community, plus essential services, reduce the inappropriate use of U.S. jails to house persons with acute symptoms of mental illness. Recommendations: continue implementing Memphis Plan to more cities, continue evaluating plans effectively, promote collaboration between criminal justice systems and mental health systems. Study 2. One of the main reasons for attacks on homeless stems from people's stereotypes against them. Study. Field experiment to assess whether interpersonal contact changes domiciled individuals' attitudes of the homeless. Methodology. The Denver Project Homeless Connect is an event that offers several social and health services to the homeless people, and volunteers are responsible for helping them through. The event drew approximately 525 homeless individuals and over 755 volunteers. Volunteers involved were offered a pre- and post-survey to assess their initial beliefs about homeless individuals. Areas included whether they thought the homeless were lazy, were a nuisance to businesses, whether most suffered from a mental illness, and if governments should spend more or less on helping them. Cultural considerations. The volunteers fit the criteria of what literature shows as the type of group that would be expected to have the most sympathy towards homeless. Volunteers were mainly liberal, college-age, and civically engaged. It is also possible that the homeless attending the PHC were more high-functioning and presentable. Intervention according to Minnesota Will. Collaboration. Collaboration because the study centered on organizing 2 different communities towards a common goal, which is that of decreasing stereotypical beliefs through intergroup contact. Level of prevention. Primary. Primary because the study's purpose was to assess if intergroups and interpersonal contact between 2 groups could reduce the negative stigma and bias experienced by one group towards the other. This is an effort to reduce the stigmatization that could lead to homeless abuse, therefore stopping it before it occurs. Level of practice. Community. Community because it is assessing and attempting to alter the beliefs and views from an entire group of volunteers towards the homeless population. Results. 385 volunteers completed the pre- and post-survey. Increased contact with the homeless changed the volunteers' perception of the homeless for the better. The mean perception rating index went from 4.17 to 5.03, but did not alter or worsen the perception about whether the government was already spending enough money to help them. 40% felt that the homeless were less of a danger after volunteering, and 49% reversed their earlier opinion that drugs and mental illness were the primary causes of homelessness. As far as policy changes, 66% experienced no changes in their opinion to help the homeless, and 26% even felt more restrictions should be placed on the homeless in regards to sleeping in public spaces and panhandling. There was a 15% increase in those who said enough is being done already. Evaluation. Effectiveness. The study was conducted based on previous studies that show in-group collaboration with stigmatized groups tends to bring the positive outcomes in the participants' perception. The study helped demonstrate this hypothesis by showing positive changes in the volunteers' views towards the homeless. The outcome of this study will hopefully prevent violence towards the homeless by decreasing the stigma that they experience by the public. Positives. The field experiment was conducted in a more natural setting, and the event was advertised weeks in advance, thus ensuring broad participation. Weaknesses and improvements. The volunteers that participated were mostly college-aged. Assessing the beliefs in volunteers is somewhat biased in that the volunteers are most likely already sympathetic towards the homeless and choose to participate in this event rather than random people participating. The types of homeless people that went to the event were also high functioning and presentable. Therefore, volunteers could have had a more positive experience than having interacted with stereotypical homeless people. The result indicated that after volunteering, more people felt that the government was already doing enough, could have been influenced by the fact that the volunteers were exposed to an event that was providing services to them there. Finally, its duration, 1 day, and the settings where the experiment occurred could influence whether attitude changes is long-term or not. Recommendations. Continue researching the contact theory and assess whether perceptions change long-term. More opportunities similar to PHC events should be held in order to allow communication and contact between the homeless and other groups to allow for a decrease in the negative stereotypes that they experience.